What if your phone can help your asthma patients breathe easier? Let's talk AI and asthma with the one who hired me back in the day, Desire LaTempa. Hi,
Hi.
guys. Welcome back to RT Shed Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the asthma lady. Yes, welcome everyone. Welcome to anyone new. And I am so excited to be back and wanted to say thank you so much to all those that attended the Association of Asthma Educators annual conference in Kansas City. Thank you to the Weezers. Thank you for everyone that said hi and came by. But today I want to share with you an amazing episode because I have another amazing guest co-host, Miss Desiree LaTempa. Yay! So guys, I am going to read Desiree's bio and I'm going to let her take over the show. We are going to be talking about AI and asthma. So it is such a trending topic and I'm excited to have her on. Okay, you guys know how I do. Let me read the bio and hopefully I get it right. Okay. With over 20 years of experience, Desiree is a proven force in transferring healthcare operations to improve quality and compliance in the overall patient experience. She currently serves as the Senior Director of Regulatory and Accreditation Affairs at Gotham Health, a division of New York City Health and Hospitals, the largest municipal health system in the United States. In this role, she oversees regulatory compliance for one of New York State's largest federal qualified health center networks. As academically accomplished, Desiree holds a medical doctor degree from a medical school in Dominican Republic, an MBA in healthcare management from Western Governors University, and a certificate in leading AI initiatives in healthcare from Harvard Medical School. She's also recognized as a certified content expert by the National Committee for Quality Assurance in Patient Centered and Medical Home Models. She's been a driving force behind community asthma initiatives, earning national recognition from the EPA and the NIH for her work at New York City Health and Hospital, Woodhull Hospital. Yes. She is a respected mentor, public speaker, a bilingual advocate. Desiree is deeply committed to advancing equity and excellence in healthcare. She actively mentors youth in the South Bronx through the New York State Latina Mentorship Initiative and has served as a faculty consultant for asthma education program, training providers, and evidence-based guidelines. And she is everything. Yes, she was my supervisor, and I love her. I wouldn't be where I am today without Desiree. Welcome, Desiree.
Hi. Thank you so much. Thank you so much for having me. What a pleasure. I mean, what an honor. And my joy, my heart is full of joy, of pride for you, Linda. I have seen your growth and I'm so proud of you and the work
Oh,
that you bring to the community, to your patients, to your colleague. I'm super proud of you.
thank you, Desiree. I appreciate you. Wouldn't be where I am without you. I really do. Okay, Desiree, let's get to your story and AI. All right. So, Desiree, what inspired your transition into the world of AI and healthcare?
Well, Linda, I see this not only like a transition, but I think that we have been integrating AI and digital solutions from a long time ago. It's just that we haven't called that hip terminology that we use today.
Okay.
But I think something like when I saw when you and I started talking about this topic, I immediately remember you and I working many years ago at Woodhull and getting grants at one moment because of all of our success. And in one of those crazy ideas that you and I usually came up during those long hours was what else can we do that we haven't done? And I don't know if you remember searching on those spirometers and peak flows
Right.
that
Yes.
it will help us monitoring the patient system
Yes.
symptoms. And we did that search, and those like peak flows with spirometer
Yes.
measures. And then we were like, they were like in a country in Asia, I'm not gonna say it,
Yes.
but you started doing the research, and we like, let's do it. And
Right,
then it was a
right.
strike, and we couldn't get those devices. But remember, those were digital solution at that time.
Right.
No, we've been part of like this whole transformation and integration, what I will call integration of AI. It's just
Okay.
that today, after COVID, it has been the boom. But
Yes.
we always been part of these advances in the digital world with the electronic medical record. Inspire me is just the same thing that we say and do every day, is trying to help the patients in a more
Yes.
effective and proactive way. That's really true, the inspiration.
Okay, okay. So with you saying that now, because I definitely do remember that. I remember the device you're talking about. Uh, so what made you from there now you're like, okay, you know what you know, and we see that it's now the hot trending thing in healthcare. What made you say this is the time to get like my certificate to dive deeper into AI?
Yes, great question. I think that getting yourself that knowledge and getting into the different words of a different aspect of a professional. We are in healthcare, and these
Mhm.
digital innovations are in the tech aspect. So as a
Yes.
end user, we know the problem, right?
Mm-hmm.
We can guide those developers to come up with the solution, but as a
Mm-hmm.
end user, providing the support and the help to our patients, and also in making sure that we advocate for the patients and bring the patient's voice into these
Mm-hmm.
innovations,
Yes.
we also need to learn their language to better
Okay.
guide them in becoming, those algorithms. We
Yeah,
need
okay.
to also understand their language.
All right, guys. So we had a little technical difficulties, but the conversation was going so good that we are just going to keep the ball rolling. So I got Desiree to come back, and yeah, we're just gonna keep it going. All right, guys. So uh Desiree made an important point where she said that we as healthcare workers um, need to be a part of these AI development, especially when it comes to patient engagement. And I think that is hitting it right on the nail. Because I also felt like that when it comes to sometime working with data people, because sometimes data people they can tend to think about just like the numbers, which we all know we need, but when it comes to us, we're the patient advocate. We think of the actual patient, and I think that that's what we bring to the AI world. So I definitely think it's necessary to be for us to be in that space. Very happy you said that. Uh, I do feel like we still have a lot of folk in healthcare that's scared of AI, and it's everywhere. So
Yes.
it's not going nowhere. That's what I see. Okay, so now with that being said, so what are some current AI tools or platforms being used to support patient education, especially in chronic conditions like asthma? So what are platforms or innovations you're most excited about? What do you see?
Everybody is scared of the AI right now, and they are scared even to use those platforms that are available today. One of those problems that we encounter every day is really the lack of regulatory guidance into reassuring us as a healthcare professional that these are safe tools to
Is it
use,
safe?
and yes, and to
Yeah.
tell our patients that we trust those tools, and then they should trust them as well. So if we
Yeah.
as a healthcare professionals are not 100% sold by these applications and digital solutions, it is more challenging. They from phone applications that help the patients with symptoms monitoring,
Okay.
even patient educations. They are apps that they can just look into it, and they describe what a asthma exacerbation is, what symptoms to
Okay.
look are, what are the main environmental factors and triggers.
Hmm.
But it is the part as healthcare professionals, are we trusting that the information that these apps are giving to our patients, the correct one? Are they being
Evidence
validated
based.
the same
Yes.
way, exactly evidence
Yeah.
based? If you remember those days that we were fighting so much to integrate community health workers into
Yes.
our, a part of the care team, and it
Hmm.
was the concept, oh, can we trust them to go to the patient's home?
Yeah.
So right
Yeah.
now, I feel like we are in that
Yeah.
moment
This
in
stage.
getting the AI into being part of the team to help
Hmm.
us extend that care management, that patient engagement into the part of the delivery system. So like there are so many right now. I always look when I in my regulatory work and being now in educating myself in AI integration, I look
Hmm.
for key factors is the integration of the application into the patient's medical record. We
Okay.
all know now, I use it all the time, my patient portal. I
Okay.
like one-stop shopping. So if
Right.
I can
Yeah.
have those apps that can be integrated into my medical record, my patient portal, are the most effective that I feel as a patient and I feel as a provider.
Okay.
There are many of them. Everybody can search for. I certainly not advertising any one of them, but
Correct. That's a
uh,
fact. Hmm.
things that I encourage the respiratory therapists and the asthma community is to please be involved. Be the ones that are evaluating those tools. Become
Hmm.
aware of those. Be the ones that are like, oh, wait a minute, let me check. Are these
Right.
giving my patients their information that I will use?
Right.
Think it this way. I always think is that digital respiratory therapists that follow my patients at home are
Hmm.
the information that they gathering from. Some of them are wearables. Like for example, I'm wearing one. This ring is constantly reading my vital signs and
Hmm.
sending that
Got
information
you.
to an app that is integrated to my medical record.
Hmm.
So
Okay.
they are the same right now, like inhalers. We have smart inhalers right now that,
Right.
as the patient use them,
The digi
they give
healers.
information.
Hmm.
Yes,
Hmm.
those
That's true.
peak flows and spirometers.
Yeah.
Right now, they are integrated with electronic medical record that send the information directly into the providers. Think of this
Nice.
way. They have ICUs right now built into patients' home. So imagine as a respiratory
Hmm.
therapist that you are like one of the core professionals in ICU. How now have these digital solutions, this AI built in the patient's home that they can help
Hmm.
monitor those vital signs and send real time information to the team and help them. I mean, it's helping you instead of like moving from one place to another one. You
Right.
can
Right.
help patients so many where. So this is like
Wow.
I usually look at these applications from like the end user, and it
Right.
can
The
please you as
experience.
a Yes, at the end user, I haven't seen that many respiratory therapists in conference that I have participated. I want to see that. I want to
Mm-hmm.
next time I go, maybe you, Linda, maybe you can be one of them, because
Mm-hmm.
talking
And I
about your
could bring
experience.
some people with me, some
Yes,
RTs and some community health workers, some
yes, yes,
pharmacists.
yes.
They in this world too. Yeah.
Absolutely, absolutely. I have seen
Mm-hmm.
pharmacists and nurses, and
Mm-hmm.
very a social worker. I haven't seen many respiratory therapists, and
Okay.
I want to see that, because you guys are a key team members in the entire care team that deliver care and patients in the ambulatory care settings, in the inpatients. So I need to see
That makes sense, Desiree. You are making a lot of sense.
that.
Okay. Because when I was at the Association of Asthma Educators Conference, there was a speaker. I forget his name. He was so good, very nice. But he was talking about the use of AI for home environmental assessments. So for those with asthma and so what the AI is doing is it would you take the picture of a specific area that you in, and of course it would tell the potential, asthma patient, client, hey, the heavy curtain that you have there is attracting dust. And based on the PM, it would tell them the particulate matter that was in the air. And I was like, oh, wow, I didn't even think about that. So things that we know this stuff, but we can't, like, I can't visually tell you what particulate matters in your air and the air quality. I can just, so I thought that was
Mhm,
I was very intrigued with that. And it does make you excited to see what's to come. And like you
mhm.
said, it's so fast. So by the time we're talking about it, it's like it's old, and AI is moving so fast. It's
Yes,
uh, it's mind
absolutely.
boggling.
I was about to say, as you say that, I remember with the community health workers. Remember one of the grants we have. I was like, okay, let's buy laptop now, and when we do the home visit, let's, with the permission of the patient, of course, let's
Hmm.
help identify what triggers they have,
Hmm.
and if they cannot feel comfortable allowing us in visiting their home, they can, use their camera in their iPad at the time to
Hmm.
help us do those environmental home assessments.
Right,
And
right.
look at today, is with those apps
I
like that, they
know.
can scan it. And
It's
remember when we
crazy.
did the allergy testing, it's like,
Right.
imagine now, as a patient, you have an allergy testing done, and you take a picture of your home and have an algorithm and AI that put all that information
Right.
together,
Everything
and
together.
now personalize a treatment for you that says, oh, you have an allergy test that says you're not allergic to a dog or a cat, and you have a dog and a cat, and then you have a test says that you are allergic, and then they
Hmm.
detect that you have that pet at home. Is
Mm.
now helping you reinforce that you have a trigger right now in your home. So
Hmm.
it's potential. It's like
I like
increasing
it.
the help at home of that, as a healthcare providers, we
Right.
cannot do in a one-to-one basis with our all of our patients.
Facts. I definitely, yes. It is like we said, like I just from what you're saying, remembering like the beginnings for us, where we're like, ooh, the iPad. We're gonna use the iPad to do, and that was like innovative, and that was like hot, and
Yes,
now we got AI.
exactly,
So it's
exactly.
so funny. Okay, so you did touch on this, like, so how can respiratory therapists, educators, clinicians, everyone use AI to improve asthma control and empower patients. So, what are some practical steps to get started? Even if you like not a techie person. So, and you already started to mention it, but like we said, we do have folks that are afraid of AI. And so, what advice would you give for them to just tippy toe, like just to get in just a little bit?
Yes. Yes, no, definitely. Great question. I will say just get involved. Don't be afraid. Ask questions. You may already been doing that for a long time, for a long time already now. If your facility, if your work, the conversation start, be part of that. You
Mm-hmm.
are the subject matter expert. There was an exercise when I was just completing my certificate program at Harvard. I think it was the most meaningful exercise when the
Okay.
professor told us, forget about the solution. Let's take now a step back and sit down. And in your area, at your work, think yourself that you are at work right now. Think on the main problem that you've been encountering for years, even though you've been doing performance improvement, different testings to change, to improve, you still encounter the same problem. Think how AI now can, if you bring AI right now, how
Mm-hmm.
can AI help you for once and for all, take care of that problem? So
Okay.
instead of thinking on the solution, think on the problem.
The
And as
problem.
a subject matter
Pain point.
expert, you are the one seeing the patients in a day to
Right.
day. You know what is going on there.
Right.
Be part of that solution by being present and by being involved. There are so many articles right now. There were just
Okay.
a release of the new guidance from the federal government on the
Okay.
use of AI.
Okay.
There are many sources of
Resources.
information,
Okay.
FDA as well. I can definitely, Linda, provide you the links for that you can share with the
Okay.
community for
Definitely do
that.
that.
But I will say right now, get involved, start participating in those conversations, and you will realize that
Nice.
you've been part of these transformations and revolution of AI. From data, looking at the data and how you
Mm-hmm.
are collecting data from an electronic medical record and
Okay.
dumping that data into now new softwares, new analytic softwares that just come up with like a different visualization
Okay.
that help you then interpret how those trends are.
Okay.
But at the end of the day, you say, Linda, you have the data people, they can do magic with that, but they cannot interpret what is going on in the timeline.
Right.
And you
They
do.
you need it. Yes, they need us.
Yes,
They definitely need us.
absolutely.
Okay. All right. So I love that. And I think okay, so because I was gonna segue to another section, but and we started to talk about this. So in the asthma world, what do you see in the future for us and AI? Like, how we can use it. And I know I mentioned the one with the home environmental assessments. I didn't even think about that one where the AI is actually doing asthma education right there and there just by taking the picture and the dust particles and whatnot. So yeah, I mean, so what do you think the future?
Yes, no, definitely. I mean, the future is so bright. It's like it's so bright that it's scary, and it's a good scary. I have to say, it's a good scary.
Yeah, yeah.
I always think about this as an enhancement of the challenges that we have right now in the medical field, that we don't have enough healthcare professionals.
It's a shortage everywhere.
Yes,
We short. Every
yes.
every discipline.
Every discipline, and people are scared of losing their job with AI. Not at
Yeah,
all. Think at this, that is has
as
actually
a
gonna
plus.
allow you to have family time, to enjoy your
Right.
family time. There are people talking about pajama time for the providers. I always like
I would
find me,
love I
yeah,
would love that.
find me a terminology for finding getting back the joy to enjoying your family and those
Family.
moments for all
Pajama time.
different yes, because it's gonna help you
Like that.
take care of so many more patients. They
Yeah.
are like a far away. What we are seeing it right now. Care management. I mean, how many times we say, what is the ratio? One community health workers per 10 patients or 20 patients
Right.
or 50 patients. Remember when we were trying to figure
Yeah.
out the design
Like what was the
with
right?
AI?
Mm-hmm.
Imagine now. kind of like a help you stratify those patients based on the risk assessment that
Mm-hmm.
AI will help you collecting all that information that is already in the patient's medical record. And then will help you concentrate in those patients with a higher risk that you
Uh-huh.
need them to spend that extra 5 minutes, 10 minutes, if not more, with that patients that need you the most. That's what I
Okay.
see AI helping the community, the asthma community in long term is
Okay.
really
Case
being
management.
available regardless if you have a shortage. I mean,
Mm-hmm.
the sky is the
Which,
limit.
yes, it is. And to me, with the shortage, it's an ongoing problem. It's not because and think of it, it's every generation is less people.
Yes.
And then what I'm seeing, and this is why I do what I do, because I what I'm seeing is uh the younger folks, some of them don't want to be in the healthcare field because I think they just don't want to do it. They don't want to deal, but I like when people are showing like the heart of healthcare. Like we really love what we do. Those of us that love what we do, you know what I'm saying? And yeah, it's just not enough. So and the problem is going to get worse before it get better. And
Oh,
so
yes.
I do feel like AI will help us to leverage at least in those aspects that. Um, Desiree, this is good stuff. I mean, because this is the time. It's this is very relevant to now
Mhm.
because it's everywhere. So yeah, so okay, so just to recap what we spoke about, uh, for healthcare providers, and healthcare workers, professionals, we just have to be present. We have to be at the table when it
Yes.
comes to the AI stuff. Just when it comes to AI development, the use of AI and guiding our patients. We have to at least be a part of the conversations, um, versus just letting patients be in the wilderness of
Yes.
because it's gonna happen. It's the same thing. This is why I do what I do with the podcast. It's the same thing with content, social media, and people don't need any credentials and they say anything. And if you're popular, people will take your advice. And it's like that's
Mhm.
not. There's no evidence behind that.
Yes.
It's a very it's very scary. But and I can easily see that with AI too. If the right people are not developing these tools, then yeah, it's not going to benefit our patients. Desiree, so this is your time to plug away. How can we find you? What do you have going on? How do you want what do you want? What's your final closeout? What do you want folks to know?
Yes. Well, first, I just want you guys to have ignited the that little word or head in the back of your head, that telling you, oh, I need to get involved with this today. I mean, yesterday. Let me start researching on this. You guys, I will say, join me and join Linda in this crazy passion for healthcare to provide patients evidence-based guidelines
Yes.
in every aspect. I am a public health employee. You can reach me to in any one of the New York City health and hospitals,
Yes, ma'am.
federal qualified health centers.
Okay.
If any activities that is going on in the community that is advertised by the New York City Health and Hospital, and you want to participate or join, let me know. I will join you in any one of those activities.
Okay.
Linda is one of them, the ones that can tell you those crazy community as back to school, the
Right.
3 bottle asthma bike
Right.
drive. It's everywhere.
Yes.
I will say that I am in LinkedIn. You guys have any questions, feel free to send me questions through
Okay.
there. I'll be happy to collaborate in anything that is enhance patient care, patient
Okay.
engagement, advocacy. If I use this platform, for those of you that love to be volunteer and mentors, join a mentorship program I
Okay.
did for the Latina community as an initiative from the governors. Get involved. You never
Yeah.
know where those topics will take you. I mean, I
Yeah.
got involved in this for a conversation that I have with a chief resident that I worked many years ago. So
Mm-hmm.
yeah, and then it was through LinkedIn. So
Okay.
like I
Okay.
said, I'll be more than happy to talk to anybody, to learn from each other. I mean, I
Excellent.
enjoyed Linda this podcast. I have seen
Yes.
speakers in here that I was like, oh my God, I want to
Right?
hear this.
Yes,
Yes.
yes.
Oh
I
my God.
appreciate
Yes.
folks like you. Yeah, yeah. Because
Yes.
it really is I really try to get folks to speak, not only experts, but like people that genuinely are passionate about what they're doing. Because you could be good at something, but if you when you speak from your heart and you want to do it, it just people really can feel that. So that's really who I try to get on the RT Shanty podcast, and it's been going good. People, and I'm
Yes.
glad that people trust me, to do that. So it's been very very a refreshing experience. I'm happy. Desiree, thank you so much for your time. I appreciate you. I know we are having internet connections, but your message, you drop the gems. And I think that you definitely opened our eyes to the possibility of AI. And I see it. I definitely do. So and maybe as AI starts to pick up, I can have you back and we could talk further because it looks like this thing is going to be, you know what I'm saying, by the time next year or however many years, you know what I'm saying? So I'll definitely keep you in my back pocket as an expert in AI in the healthcare space. So very excited to have you back in the future. Guys,
Yeah. Thank you
yes.
so much.
No problem. Guys, thank you so much for being here with us. I just want to say thank you for growing with us. We are here on most podcast platforms on Wednesdays, except for when I'm on vacation. And we are on YouTube on Thursdays. So there is so much more to come. Thank you so much, guys. Feel free to join the conversation. Let us know what you are seeing on AI in the healthcare space. I would be very happy to hear what you're seeing and what you think is going on and your thoughts. All right, guys. So thank you so much. I'll see you next time.